Ladies and gentlemen, welcome to our Early Detection Save Lives webinar, a heartfelt breast cancer awareness month initiative brought to you by Azista Industries. Today, we embark on a journey of enlightenment, empowerment, and advocacy. Breast cancer is a formidable adversary affecting countless lives. Awareness is our beacon of hope, our strongest defense. In the fight against this disease, knowledge truly is our power. We are honored to have with us a true inspiration of knowledge and compassion, our esteemed keynote speaker, Mr. Ajay Gupta. Dr. Gupta is a senior consultant in medical oncology at Apollo Hospitals, New Delhi, and brings a wealth of expertise to our cause. Join us as we delve into the importance of early detection, the signs and the symptoms of breast cancer, and explore the latest advancements in the treatment. Let's unite to save lives and spread awareness. Welcome, Dr. Ajay Gupta, and welcome
Thank
to you
you.
all.
Thank
Together,
you
we
very
can make a difference.
Thank you very much. It is indeed a great privilege to be here amongst all of you people and addressing a very important health issue, which is a problem for the entire society or the entire world at large. That is cancer, and especially breast cancer, because it's the most common cancer in females worldwide, and it afflicts a lot of people. The problem is that it can be detected early enough, and yet we see so many advanced cancers, and there the prognosis is really poor. So early detection and prevention, early detection and treatment, they are the cornerstones of improving survival for breast cancer, besides evolving new treatment methodologies and drugs.
So, coming to the first
So coming
segment,
to the first
understanding breast cancer.
question.
So, the first question is, what is breast cancer and how common is it?
So cancer is uncontrolled growth of cells. So it is derived from the Greek word onkos. So skin cancers and breast cancers, they usually grow out of the tissue, and they looked like a crab which is holding onto the body and which is not easily separated. So the word came oncology, and the people who are dealing with it became known as oncologists. So cancer is uncontrolled growth of cells, and it's as old as humanity. And breast cancer is a lump which forms in the tissues, which is smaller in the breast tissue, which is small at first. It is usually from the milk ducts and the lobules. It usually arises from there, and these cells, they just multiply first within the duct, then outside, and then they create lumps, and then as they grow bigger, they spread through the lymph nodes and the bloodstream to give rise to nodal deposits, and they become locally advanced and that fungate through the skin also. So once the cancer is uncontrolled, it pretty much spreads everywhere. So the second part of the question deals with how common breast cancer is. So they are in their lifetime 1 in 7. So the figures varies between 1 in 3 to 1 in 8 women developing cancers in the Western populations, and in India it's estimated that 1 in 20 women will develop breast cancers. However, our urban areas, we have lifestyles which are even worse than and our dietary habits and lifestyles are worse, and our pollution is much worse than in the Western countries. So I suspect in urban cities we will have a problem which is much worse in magnitude than what we see in even Western countries. So instead of 1 in 20, I will put 1 in 8 women will develop breast cancer in India in their lifetime in urban areas. That is to say the least.
Okay. So, then coming to the risk factors and signs and symptoms. So, what are the risk factors of breast cancer?
So there are many risk factors which are attributed to breast factors. So I'll stress on them one by one. So one is obesity. Obesity has been also been linked to breast cancer. Smoking has also been linked to breast cancer, as has been alcohol, lack of exercise, and then late pregnancy or no pregnancy, early menopause, late menarche. So all these problems, they are uh, so late menopause and early menarche, they are, and lack of breastfeeding. So they are all risk factors for breast cancer. So the late childbirth or no childbirth is also a risk factor for breast cancer. Then we have genetic factors. So a small percentage of breast cancers are hereditary in nature. So women have combined syndromes known as BRCA1 and 2 syndromes, which they are prone to developing both cancers of the breast and cancers of the ovary. So all of us have heard of Angelina Jolie and the fact that she had those breast cancers, and she had both the breasts and the ovaries removed and is now living a normal cancer-free life. So there are some genetic factors, then there are environmental factors, and first degree relatives. If there's a lot of prevalence of breast cancer in the first degree relatives, then one is at greater risk of breast cancer. So strong family history is also a big risk factor for breast cancers.
I see. So there are high chances if someone in the family is also having breast cancer.
Yes, so you should choose the youngest member. So if the patient is 45 years of age, then cancer screening in the family members should start at 35 years of age. That is, if one or more, two or more first degree relatives have this cancer, there's a strong family history. Then, 10 years before the index case developed the cancer, the family members should start screening for breast cancers.
Okay. So what are the common signs and symptoms of breast cancer?
So, breast cancer will usually present as a painless lump. So that's the most common presentation. Then the nipples may be, the architecture of the nipples may be distorted. Then there may be puckering of the skin. There may be abnormal discharge from the nipples. And sometimes there can be painful swellings as well, but they are very rare. So usually these are the signs and symptoms of breast cancer when it starts. Then you may feel a lump in the axilla if it spreads to the nose or in the neck, so those lumps can also be there. But usually it's a painless swelling in the breast, which goes on progressively, which is the most common uh, symptom of breast cancer.
So can we identify it early, and what is the importance of early detection?
So early detection for any disease is the single most important factor determining prognosis. If you catch a cancer early, you can cure it with minimal treatment. If you detect it late, then even with maximal treatment, the prognosis is not as good. So early detection is the cornerstone. There are various strategies in place for early detection. So one is clinical self-examination. So a lady should learn the art of clinical self-examination right from the age of 20 years. So it can be done both sitting up, lying down, examining the breast, and it can be done in front of a mirror also to see the size and shape of the nipples, if there's any uh, abnormality of architecture. So sometimes, and both sitting up and lying down, accurate uh, clinical examination done by the lady is very important. Clinical examination by the physician can be done every 3 years, but it's not always possible or feasible. And above 40 years of age or above 50 years of age, in many countries, they have a annual mammography screening program. So in an annual mammo program, it's done in many countries, but in India, because of the huge population, that would mean almost 30 crore mammograms a year. So all the radiology centers will be busy doing mammograms. So in India, it's not picked up, but for the persons who are keen and aware, they should go for annual mammography after the age of 40 or 50 years. If you are younger, then a mammogram is not that good in with dense breasts. So for if you have a very strong family history, then an ultrasound of the breast is important, and even an MRI can be done in very strong family histories. And if you have BRCA1 or BRCA2 gene mutations and don't want to go prophylactic surgeries, so there are various screening options available and various early detection tools available. And breast cancer is the cancer which is the epitome or cornerstone of catching it early and catching a cancer early. We don't see such programs for other cancers.
So coming to the third segment, which is men and breast cancer. Do men get breast cancer? Explain the rarity of the risk factors of male breast cancer.
So breast cancer can happen in males also. It is very rare, and it's there because of its rarity. It's difficult to suspect, but prognosis wise, it is the same as that in females, except for the fact that the breast tissue is small in males, so it tends to get advanced very fast. So there's a lot less scanty breast tissue in males. So the breast cancer, if it happens, it can involve the skin or become spread to the lymph nodes faster in males. So it tends to be more aggressive in males, but treatment principles remain the same. And with early detection, you can cure it.
So then coming to the early detection and screening, which is our fourth segment, why is early detection crucial and how can it saves life?
So I've
And
already
before,
stressed upon
and
that in my previous talk, but early detection is the cornerstone. So if you catch a tumor which is 1 centimeter in size by mammography and excise it, then you're in much better shape than when you detect it when it's 3 or 4 centimeters or it is spread to the lymph nodes and other areas and it's become more advanced. So the earlier the stage, you have close to 90% survival rate with the stage one cancers. With stage two, it comes down to 80, 70 to 80%. With stage three, it's around, with locally advanced, it's around 40 to 50%. So that's the survival rate. So stage four, it's much less. So the cure rates are much higher when you detect any tumor early. It's true for any tumor, whether it's of the head and neck, whether it's of the bones, any tumor. So early diagnosis and treatment is the cornerstone of management of any disease, not even cancer, even for a pneumonia, for an infection. Early diagnosis and treatment is everything.
okay. So detail about different screening methods for breast cancer.
So I've already detailed about the screening methods. I've detailed about the clinical self-examination.
Mhm.
I've talked about physician examination, and I've also talked about mammography, and I've also talked about ultrasound and MRI done in special circumstances when the age is low and the risk is high.
Right. So then coming to the breast cancer treatment, which is our fifth segment, what are the various treatment options available for breast cancer?
So the treatment, so the breast cancer is divided into three parts. So one is early breast cancer, second is locally advanced breast cancer, and third is metastatic breast cancer. So for early breast cancer, that is small lesions with small disease, small volume of disease with no lymph nodes involved, we usually do surgery first. And with surgery first, we do the tumor. So there are two types of operations. So one is a modified radical mastectomy. So William Halsted did the first surgeries in the 19th century, which was a radical mastectomy. So this has now been modified into the modified radical mastectomy, which is not as mutilating or elaborate, but removes the entire breast. So this is the gold standard for all surgeries, but many women are hesitant for the entire breast to be removed. So in that case, you have options like breast conservation surgery, where only the lesion or the quadrant, the tissue surrounding the breast is removed, and the entire breast is not removed, only the portion which is diseased is removed. But we need to supplement it with radiotherapy always. So radiation always needs to be given, and monitoring post the partial mastectomy or the breast conserving surgery, he needs to be more intense to detect local recurrences. Otherwise, the survival is supposed to be the same, but the key note is that there should be more uh, vigilant screening post the surgery for any detecting any recurrence as compared when you remove the breast in total. So this is early breast cancer. So after this, depending on the tumor characteristics and the age, patient would be given radiotherapy. So radiotherapy is usually given if the tumor is more than 5 centimeters or if more than four lymph nodes are involved. In selected cases where 1 to 3 lymph nodes are involved but they have bad risk features, and when breast conserving surgery is done. So even if the tumor is 1 centimeter in size and there is no lymph node positive, with the breast conservation surgery, saying no to radiotherapy is not possible. You have to go undergo radiotherapy every time. So This is for the local treatments. Systemic treatments depend on the characteristics of the tumor. So that any breast tumor is of three types. First is it can be hormonally driven, that is estrogen receptor, progesterone receptor positive. Then it can be driven by oncoproteins, that is proteins which whose synthesis leads to increased expression of the tumor cells. So that is a HER2-driven cancer. And the third is the basal type or the triple negative variant, which is neither hormonally nor HER2 driven. So the treatment, systemic treatment is different for all three. For the triple negative variant, which is the last variant, it's only chemotherapy. For HER2 positive tumors, we have a combination of chemotherapy and targeted therapies which are directed at HER2 protein. So these include antibodies like Herceptin and Perjeta or pertuzumab. And for hormone-driven tumors, so the we have the best prognosis, and there are treatments like tamoxifen, hormonal treatments which can go for 10 years, or we have in post-menopausal women, we have different options like aromatase inhibitor drugs. So like aromacin, letrozole, or anastrozole, which can be given for 5 to 7 years. So this is basically the treatment. And for locally advanced tumors, we like to give chemotherapy first to shrink the tumor and make surgery possible. So for hormone chemotherapy is common for all three subsets which I had discussed earlier. But in addition to the in HER2 driven tumors, we add targeted treatments like Herceptin or Perjeta to shrink the tumor as much as is possible. So we like to give the chemotherapy upfront in locally advanced tumors, and after that we do the surgery, the radiation, and subsequent treatment usually includes hormonal treatment in patients who are hormone receptor positive, and extended Herceptin and targeted treatments in patients who are HER2 positive. We also have extended oral chemotherapy for patients who are triple negative, that is neither hormonally driven nor HER2 positive. For metastatic disease, we don't go for metastatic disease means tumors which have spread all over. So again, the treatment is, we also like to balance quality of life. We are bothered about quality of life issues in these patients. So for hormonal driven tumors, we like to give hormonal therapy. For HER2 driven tumors, we like to give hormone therapy. And for triple negative tumors, we have to give chemotherapy, but we sequence various agents, like to give single agents so that the quality of life is maintained and we are able to prolong the life of the patient as much as is possible. Latest advances include addition of immunotherapy to various regimens. So there are immunotherapies, hormonal injections, new drugs which are coming up like ribociclib, that is CDK4/6 inhibitors. So there are various developments in the field, but broadly we stick to these guidelines and try to add various treatments to make the survival even better.
Okay. May I know the difference between radiotherapy and chemotherapy and the usage of radiotherapy and chemotherapy?
So radiotherapy is high energy X-rays. So it is given to kill the cells which are present in the breast tissue and which may have escaped the surgery. So radiotherapy is a very localized form of treatment which is given only to the breast and the axilla, that is the armpit lymph nodes. It covers the armpit lymph nodes and the breast tissue. So it's given to sterilize those tissues. So it's more of a role in breast conserving surgery where only a portion of the breast is removed. So there may be small satellites of tumors present in those tissues. So we have to sterilize it by radiotherapy. So chemotherapy is chemicals which sort of get are given either orally or intravenous route. They come into the bloodstream, and when they go to the bloodstream, they attack the tumors. And when they attack the tumors, then the tumor cells incorporate them into their system, and they damage the DNA and the uh, mitotic, that's the cell division of the tumor cells. So they kill the cells because they interfere with cell division and they interfere with the structure of the DNA. So that is chemotherapy, and various agents have been used for chemotherapy for breast cancer, starting from methotrexate to adriamycin to even the platinum compounds, the platinum you have got carboplatin. So all these are chemotherapy agents which are used in breast cancer.
So, chemotherapy has any side effects like hair loss? Does it have?
Yeah, so chemotherapy affects other cells of the body as well. It attacks the fast dividing cells of the body. But these agents actually they damage the tumor more and the body cells less. But you can have, therefore, you have various side effects like nausea, vomiting, hair loss, low white cell counts, and sometimes it can affect the heart and the nerves also. So chemotherapy needs to be given in a regulated fashion by a good professional and in a good setting, and where the entire risk assessment of the patient is done and the patient is monitored regularly from time to time. So there can be some short-term effects, and rarely there can be some long-term effects like secondary blood cancers or heart problems with the chemotherapy, but that is rare. And therefore, we need to use our agents very judiciously based on the age and stage of the patient.
And doctor, what is the possibility of regrowth of the hair after the chemotherapy?
So usually after 6 weeks time, the hair start coming, and in 3 months time, the hair are sometimes even better than the ones the patient had previously. Sometimes the patient had gray hair earlier, now they become black. Earlier they were straight, now they become curly. So it's a temporary issue for which we are not bothered much at all.
Okay. So, what is the recent advances and prognosis that is coming to segment 7? If you can share us the recent advances and treatments, cancer treatments,
So the in cancer treatments in general or in breast cancer?
uh, in breast cancer.
Okay, so I think it will become very specific for breast cancer, but I'll just tell you the various ways the treatments have progressed. So basically, initially it all started with chemotherapy. So earlier, cancer was a disease, nobody knew what was happening and how to go about it. So, in the First World War and the Second World War, poison gas was used. So, there was a poison gas named as nitrogen mustard, which was used earlier, and it was found that it led to a reduction in the white cells amongst the people who survived it. So, it was the first agent, and it was tried in leukemias or blood cancers, and temporary success was achieved. Then a drug was synthesized by the name of methotrexate, and this methotrexate was synthesized by an Indian chemist known by the name of Mr. Subbarao, and this led to the first cure of cancer in a disease known as carcinoma. So then these various agents came up, and belladonna was the first. Bonadonna was the first regimen. CMF regimen was the first regimen was for breast cancer, and this led to remarkable success in the field. uh, but it was so paclitaxel was a drug which was derived from the Himalayan bark of the Himalayan yew tree, and it was also used in these cancers. Adriamycin was another drug. Cisplatin or platinum was also used in breast cancers. So a lot of these chemotherapies came, but it was discovered that chemotherapy was not the final word. So you did surgery, the cancers came back. So you gave chemotherapy, then some cancers were cured, but some cancers came back. So then another research was done into the molecular mechanisms surrounding how the tumors grew. So this gave birth to the field of targeted therapies. So various targets were identified in the cells, and various medicines were devised accordingly. So hormonal agents like tamoxifen, aromatase inhibitors were devised, and then targeted therapies like monoclonal antibodies against the HER2 protein, that is Herceptin or Perjeta, were devised. And but it was discovered that even with targeted therapies, the tumors was coming back. So then there's further research in targeted therapies. So drugs like ribociclib, palbociclib, they were made to counter in the hormonal receptor segment. So the hormone receptor sensitive segment to add on to the hormones to increase their efficacy. Then various immunotherapies also came into being. So it was discovered that cancers were actually shaking hands with the immune system of the patient, and they become friends, and the cancer was not getting destroyed. So new drugs like nivolumab and Keytruda, pembrolizumab were devised, and they broke the handshake between the cancer and the immune cells. And once they broke this handshake, then the cancer cell was identified as foreign, and the cells were attacked, and this resulted in greater cell kill. So all these are latest advances which are happening in the field of cancer. New targets and new immunotherapies are being devised every day to increase the prognosis and better the prognosis and lessen the toxicity of cancer treatments.
That's good to know, doctor. So coming to the survival rate, what is the survival rate when coming to breast cancer?
So it all depends on the stage. For locally advanced breast cancer, it is around 50%. For early breast cancer, it varies from 60 to 80%. And for very early detections, 1 centimeter tumor is almost close to 90% or more. So the survival rate depends on the stage of the disease. Then it also depends on if you have a hormonally positive cancer. That is, you have a very good hormonal treatments which can be given for 5 to 10 years. So the prognosis is much better. And for the triple negative subgroup and the HER2 new subgroup, which have done traditionally worse, and newer treatments are being devised to improve the prognosis in these subsets.
So coming to the survivorship, how is life after breast cancer?
So
If you
life
can.
after once the treatment is over, then you are pretty much done and dusted with the disease, and you have to get back into life. So you know they have so there are body image and dysmorphisms and body image deficiencies related to psychological impact of breast removal. So but it requires good psychological support, and it's not a major issue. A lot of women are putting in prosthesis and other things, or dressing up, so that it doesn't make a difference, and they are able to carry on with their lives. So unless you have had a bad side effect of chemotherapy or treatments which is permanent, then except for the psychological scars which you get during any illness, be an accident also, it's not that much of an issue now, especially in breast cancers.
Okay. So as we now understand the importance of early detection, the survivorship is majorly defined by early detection. Can you share is like how youth of like ages of 30 plus can self-scan their breasts, and how often they can scan their breasts?
So they can scan every month, usually, and they should scan on the same day every month related to the periods and cycles. And it can be done lying down, standing, and in front of a mirror. And you should palpate all areas of the breast and see if there is any lump visible. Then you can raise your hand and see for the symmetry of the breasts. And you can examine the nipple if they are in the same position or in different positions. If there's any puckering of the skin or there's any nipple discharge, and if it's problematic, don't hesitate to consult the doctor.
Okay. So that is really helpful. And can you share a message to all the youngsters and educated men and women?
So, what I want to stress is that it's not breast cancer cure and treatment and early detection is not related to education, it is related to awareness and self motivation. So, unfortunately, even in very highly educated families, I have seen ladies developing small breast cancer. They are becoming very big and big and big, and it gets bigger and bigger, and it becomes a huge problem. And they refuse treatment, and they use their education as a shield to logic, to give logics against accepting treatments, and then accepting surgeries and accepting diagnostic methods also. So it's not really related to education, but you should be sufficiently motivated that as soon as you detect it, the sooner you start treatment, the better your prognosis will be, and less morbid will be the treatment. The lesser it will be, it may mean you may escape even without chemotherapy, without radiotherapy, just a simple surgery might help you. So you should be highly motivated and should not be afraid, and should seek help immediately.
Okay. So we have few questions from the audience, if you permit us. So increasing weight will have a chance of women getting affect to breast cancer. If yes, why?
So increased the obesity is linked to the various hormones and hormonal disbalances, and obesity is an independent risk factor for uh, breast cancer. So we have hormonal disturbances associated with it. Then there's a fat produces a lot of estrogen and other hormones also which drive breast cancer in. So mild degree of overweight is actually supposed to be slightly protective, but being more overweight is definitely linked to breast cancer.
Okay. This question is from Dr. Minali Rawat. So the question is, what is mass in left breast is Benjamin? Uh, Fibrodemina mean as my mammogram shows this.
So you need to be examined by a you need to be examined by a physician. A fibroadenoma is usually a breast lump which is known as a breast mouse because it's very mobile inside the breast. It's a benign tissue and it's easily removed by surgery. And only a small incision needs to be made, and only the lump needs to be taken out. So if it's a fibroadenoma, you need to confirm it by seeing your physician first.
Okay. So the next question is, which hormone is actually responsible for women breast cancer?
The estrogen and progesterone, they are the female hormones which are supposed to be responsible for female breast cancer.
Thank you, sir. Then, can breast cancer be fully cured?
Yes, early detection and cure. So we have 90% plus survival rates in patients who have very early breast cancer, and almost 80% in early breast cancer, and even in advanced stage breast cancer, we have 50% survival rate. So it means that in 80 to 90% or 50% of the ladies, their cancer will be fully cured.
Uh, the next question is, why older women are at higher risk of breast cancer?
With age, you become more prone to breast cancer, all cancers. So if you've not developed by 60, then if you develop past 70 or 80, then there's a greater chance of developing cancers with the increasing age. So it's just related to the risk of living more.
So, is food nowadays, pardon, is food nowadays a reason for breast cancer? If yes, what kind of food need to be avoided? Which is good food to be taken?
So green leafy vegetables, fruits, avoiding fats, avoiding oils, burnt oils, alcohol, cigarettes. So these are things to be avoided, and a balanced good diet with green leafy vegetables, legumes, fruits, and adequate but less it should not be a high calorie diet. It should be a normal calorie diet, normal for each and body.
Understood. What are the comorbidities of breast cancer?
So breast cancer can be associated with comorbidities, but there are no comorbidities as such with breast cancer. So it can be associated, patients may have heart disease or hypertension or other diseases in association, or obesity in association with breast cancer. So these are the comorbidities, but breast cancer as such is not a comorbidity. It's a morbidity itself.
Okay. So I think that's it with the questions. So thank you very much, sir. On behalf of Azista Industries and everyone who joined us today, I want to extend a heartfelt gratitude for your invaluable contribution to the Breast Cancer Awareness Month webinar. Thank you. Thanks a lot. Thanks for the insight.
Thank you very much. It's a great time talking to you and interacting with the audience.
It's our pleasure.
Thank you, doctor. Thank you very much for your cooperation and accepting our request to come on your busy, tight schedule. Thanks a lot from Hetero Healthcare also.
Thank you very much.